Respected chairpersons and moderators of session, ladies and gentlemen, good morning to everyone. I am Dr. Namkha Dorji. I work as a gynecological oncologist and obstetrician at the National Referral Hospital of Bhutan, and also as an assistant professor at the Kheser Gyalpo University of Medical Sciences of Bhutan. And today I'll be talking about a small study that we have performed on evaluation of the diagnostic performance of colposcopy in the diagnosis of histologic cervical interepithelial neoplasia type neoplasia 2+, which we call CIN2+. So for this study, I have no conflict of interest to declare, except the study is already published in BMC Cancer. So I would like to convey the greetings from His Majesty the King of Bhutan and the people of Bhutan to all of you who are gathered here and the people of Bangladesh. So these are the authors of this study, who are the gynecologist, pathologist, and colposcopy nurses working at the National Hospital of Bhutan. So in 2020, cervical cancer was the fourth most frequently diagnosed cancer and the fourth leading cause of death amongst women, with an estimated 604,000 new cases and 342,000 deaths worldwide. It is the most common cancer and the leading cause of cancer deaths among Bhutanese women. Persistent infection of cervix with high-risk human papillomavirus has been established as a necessary but not a sufficient cause for developing cervical cancer. The highly effective primary HPV vaccination and secondary preventive measures make the cervical cancer a nearly completely preventable disease, justifying the World Health Organization's ambitious target of eliminating cervical cancer by 2030 through 90-70-90 strategies. Colposcopy is an important adjunctive procedure in screening of cervical cancer. It helps in studying the size and location of precancerous lesions. We then either confirm presence of precancer by taking a biopsy or advise treatment without confirmation, which we call see and treat. However, the performance of colposcopy in the diagnosis of cervical pathology has a wide inter-observer variation depending on the duration of the experience of the colposcopists. So the objective of this study was to evaluate the performance of colposcopy in the diagnosis of histologic CIN2+ at the National Referral Hospital of Bhutan. This was a cross-sectional study which was conducted over a period of 6 months from March 2021 to August 2022, involving Bhutanese women who have undergone colposcopy and had cervical biopsy either in the form of punch biopsy or lip. This was recruited through convenience sampling method, and we have included a Bhutanese women who are married or unmarried but sexually active between the ages of 25 and 76 years, abnormal cytology result, postcoital bleeding, intermenstrual bleeding, postmenopausal bleeding, and unhealthy cervix. And the exclusion criteria for this study were obvious cervical growth, history of lip or CKC or cryotherapy, those who were treated for invasive cancer either with surgery or chemoradiation therapy, or women known to be pregnant or in the postpartum period. So the data on socio-demographic details of women were collected using an interviewer-administered questionnaire after obtaining a written informed consent. The data variables were age, place of current residence, educational status, marital status, occupation, age at first sexual intercourse, age at first childbirth, parity, and the monthly income. Niltam is the Bhutanese currency. And there were 5 colposcopists involved in this study who were trained in basic colposcopy from Thailand. And 2 colposcopists who had the experience of more than 10 years were categorized as senior colposcopists. And the remaining 3 with the experience of less than 10 years were categorized as junior colposcopists. So we used video colposcope EDAN C3A within the magnification of 6 to 12 for this study. We have followed the standard steps which is described in the International Agency for Research on Cancer Manual of Colposcopy, and the colposcopy findings were documented according to the International Federation of Cervical Pathology and Colposcopy nomenclature, and so scores were calculated. So the study was described as the colposcopy findings were described as normal, low-grade lesion, high-grade lesion, and suspicious of invasion. And punch biopsy from densest SU2 areas near squamocolumnar junction, and multiple biopsies in cases of normal biopsies were taken, either using punch biopsies forceps, or in some patients we did LEAP under total intravenous anesthesia. And the histology examination was done in the pathology department of the National Referral Hospital of Bhutan, and it was reported in accordance with the terminology of WHO classification of female genital tumors, 5th edition. So we use the EP data for data entry and stata for analysis. And for the statistical purpose, CIN2 plus or disease positive were histopathologic diagnosis of CIN2, CIN3, CIS, and invasive cancer, where SCIN2 negative were diagnosis of normal inflammation and CIN1. So this is the result. The maximum had normal, and colposcopy maximum patient 32% had normal. And when it comes to histopathology, 33% had normal, remaining had chronic cervicitis, CN1, CN2, and SCC. And this equal number of colposcopies were performed by senior as well as junior colposcopies. And this is the main result. So the senior colposcopy had the sensitivity of 80%, specificity of 71%, accuracy of 72%. And junior had specificity of 59%. Sensitivity of 59%, specificity of 76%, and accuracy of 72%. And overall, 66.67% was sensitivity, specificity was 73%, and accuracy was 72%. So in conclusion, the sensitivity among senior colposcopists was higher than junior, specificity was lower, and the accuracy was comparable between senior and junior colposcopists. However, the performance in our setting was lower than some of the similar studies conducted elsewhere in the world. So we needed to take corrective measures towards improving the performance of colposcopy, such as performing colposcopy by following the standard colposcopy steps, regular refreshers courses for the colposcopists, regular supervision, regular quality assurance, so that the Bhutanese women get the best service they deserve. So was there a programmatic impact from this small study? Yes, it did. And based on this study, we have developed this practical guideline on colposcopy and treatment of cervical precancers in Bhutan. So we are going to sensitize colposcopists, pathologists, colposcopy nurses, and scrub nurses. And we want to monitor the service provider based on the preset checklist which is inside the guideline. And what is next? After all this procedure, we will conduct a study to see if the guideline standardization, sensitization, and clinical monitoring lead to improvement in colposcopy performance and treatment of cervical precancers in Bhutan. Then let us see if our hard work was worth or not. Thank you.